You're listening to the Mother to Baby podcast, medications and more during pregnancy and breastfeeding. Ask the experts with your host, genetic counselor and mom of three, Chris Stallman.
Hi, everybody, and welcome to another Mother to Baby podcast. My name is Chris Stallman, and I am a genetic counselor, I'm a mom, and I'm a teratogen information specialist. So for those of you who don't know, teratogen information specialist just means that I give women and healthcare providers information about exposures during pregnancy and breastfeeding. And an exposure can be anything. So it could be a medication, it could be an occupational exposure, something that happens at your job, or it could be alcohol, hair dye, or anything in between. Happy New Year to all our listeners out there. Very happy that you're joining us in 2020. And because it is January, it is National Birth Defects Prevention Month. So we have two very special guests lined up for you today to talk about birth defects and give us some helpful information. As a reminder, MotherToBaby is a nonprofit organization that gives information about exposures during pregnancy and breastfeeding, and there are many different ways to contact us. So you can reach us by phone, you can reach us online, through our website, through email, chat, and text. And all of that information and more is available on our website, MotherToBaby.org. And as I mentioned, we have two special guests. So we have Kate Russell Woodworth, who is a pediatrician and a medical officer in the Division of Birth Defects and Infant Disorders at the Centers for Disease Control and Prevention, also known as the CDC. She is studying emerging threats to mothers and babies. She earned her master's in public health at Boston University and a medical degree from the Geisel School of Medicine at Dartmouth. She completed her pediatrics residency training at Duke University. She is a fellow of the American Academy of Pediatrics, and she's also a mom of a 2-year-old named Hannah and a 5-month-old named Felix. And in addition, we also have Kara Polin, who is a health scientist and also works at the National Center on Birth Defects and Developmental Disabilities. Kara currently has 1 child at home and is pregnant with her second, which is due a little bit later this year in the spring. Kate and Kara, thank you so much for joining us today.
Yeah, thank you for having us. Great to be here.
And what we're going to be talking about today are the 5 tips for birth defects prevention. Now, there are a group of experts who all get together and think about, what questions women and providers are going to have, and what are some of the things that women and providers really need to know about birth defects prevention. So when they get together, they put together a small list of some of the more commonly, frequently asked questions and have come up with this wonderful tip sheet that is very easy to use, and that's what we're going to talk about today. So Kate and Kara, what are those 5 tips?
Thanks, Chris. This is Kara. As you mentioned earlier, National Birth Defects Prevention Month is our effort to raise awareness nationwide about the causes of birth defects and their impact. So the 5 tips that we've packaged together, tip 1 is be sure to take 400 micrograms of folic acid every day. Tip 2 is to book a visit with your healthcare provider before stopping or starting any medication you might be on. Tip 3 is to become up to date with all vaccines, including the flu shot. Tip 4 is before you get pregnant, try to reach a healthy weight. And tip 5 is to boost your health by avoiding substances that may be harmful during pregnancy.
Great. And how did the two of you develop an interest in the prevention of birth defects?
So this is Kate, and like you mentioned, I'm a pediatrician, and so my first introduction to the world of birth defects was actually in the clinical arena, and seeing families and infants and children who are affected by birth defects. And from there sort of came the natural desire to want to look upstream into methods to be able to prevent birth defects and also to improve outcomes for these infants and families.
And this is Kara. When I was in grad school, I was learning about risk factors for various infectious diseases and things like that. And when I started looking for jobs at CDC, we were interested in a lot of different topics. But my mom, as I was growing up, was a speech pathologist for children under the age of 3, and we used to talk a lot about kids that she worked with and some of the challenges they faced. And a lot of those children had birth defects like cleft lip. And so I was kind of interested in that personally, just based on those conversations with my mother. And now as a parent of a child of my own, and a future baby on the way, it's become even more personal to me now.
Yes, and birth defects are common, costly, and critical conditions that affect nearly 1 in every 33 babies born in the United States each year. And so many of us actually know of family members or friends, or have even been affected by birth defects ourselves. The causes of many birth defects are multifactorial, including genetics, including incorporating our behaviors, the environment. And with many birth defects, we just don't know what the causes are.
Yeah, like Kate mentioned, we know a fair bit about some risk factors for birth defects, but there's still many opportunities to learn more about the potential role of different factors like nutrition, things in the environment, things that maternal health conditions, different infectious diseases during pregnancy. So it's an exciting and important field of research.
And I'm really glad that the two of you both touched on that, because we do know, of course, that there's always a chance, at least in the beginning, that there is a risk for birth defects. It's not usually considered to be a high risk, but it is certainly there. And I think that prevention is absolutely amazing. Although we do mention too that in some cases, again, with a lot of unknowns, it's really difficult to say. But even if a woman lived in a bubble for 9 months, there's still going to be a chance that she could have a pregnancy with a birth defect.
Yes, true.
Okay, so let's jump right into tip 1. I heard a mention of folic acid, or was it folate? And I got to tell you that I'm not 100% clear on the difference. So what is the difference between folic acid and folate, and which one should women be taking?
That's a great question, Chris. I think there's a lot of information out there that can definitely be confusing to parents and moms-to-be. So folate is the general term that is used to describe the many different forms of the vitamin B9. Folic acid is the man-made kind of version of folate. It's the form that's found in multivitamins, that's added to foods like pasta, cereals, breads, those kinds of things. And now it's also in some corn masa flour, or the type of flour that you use to make tamales and tortillas. These foods are called enriched. So if you look at the label, you'll see that on the label. Natural folate is found in foods like leafy green vegetables and citrus fruits. The important thing about folic acid, and the reason why we recommend that women take it, is that it's the only form of folate that's been shown to help prevent major birth defects of the brain and spine. So CDC recommends that all women who could become pregnant can consume 400 micrograms of folic acid every day. And this is in addition to the foods rich in folate from a varied diet. And all of this together can help prevent these types of birth defects. So it's a pretty key recommendation that we try to make sure women are taking this supplement before they become pregnant and have enough folate in their blood to help prevent these types of birth defects.
So is 400 micrograms the minimum recommended amount for every woman, even if she's not actively trying to get pregnant?
Yeah, so the reason we start before pregnancy is most of the birth defects of the brain and spine happen really early during pregnancy, before a woman might know she's pregnant. And, folic acid has a lot of other benefits, like it's good for your hair and nails. So there's really a benefit to having folic acid in your diet anyway. A lot of pregnancies aren't planned, and so if you may become pregnant, the recommendation is to try to have enough folic acid and a high enough level of folate in your blood to prevent these birth defects if you should become pregnant.
And we do recommend that women take a supplement in order to get the recommended amount of folic acid, because it's important to eat a balanced diet that's rich in natural folate. It's actually very difficult to get the recommended amount from food alone. And just to give you an example, in order to get 400 micrograms of folic acid, you'd have to eat 459 peanuts, 12.5 cup of raw green beans, or 14 oranges, just to name a few examples. And so I think, even if your pregnancy cravings happened to be citrus fruit, it would still be very hard to eat that many oranges.
So in a day, like 12.5 cups of green beans in a day.
Yes.
Oh, wow.
Order to get 400 micrograms. So that's why we recommend the supplement.
Thank you for that recommendation. I love green beans, and I got to tell you, I'm not even sure I could do that in a day. So that is good to know. Tip number 2 discusses talking with your healthcare provider about medications you're taking to see if they're recommended for use during pregnancy. Now, whether you plan to become pregnant or not, that's going to be a good idea, again, just in case a pregnancy does happen. And at Mother2Baby, that's a big part of what we do. We do answer questions about the use of medications during pregnancy and breastfeeding. And so if you need to change your treatment plan, in many cases, it's better to do so before becoming pregnant. And so having that information, either from your provider, from a Mother2Baby specialist, or both, could be very helpful.
Yes, absolutely. And this even includes not just prescription medicines, but just wanted to point out too, again, that over-the-counter medications, herbal and dietary supplements often fall in this category as well. And a healthcare professional can really help weigh in on the benefits and risks of treatment to help find the best treatment options for you and your baby. And many women need to take medication in order to stay healthy throughout pregnancy. And it's important to treat chronic medical conditions during pregnancy. But fortunately, we live in an area where there's often more than one treatment regimen available for most women. And so it's really about finding the safest and most efficacious treatment options for both moms and babies.
I cannot bold, highlight, underline that enough. The idea that, some women are able to stop medications depending on what the issue is, and some women are absolutely not. So working with your provider, again, is going to be the absolute best way to make sure that you're being treated as well as you need to be, and that you and baby remain as healthy as possible. Okay. Tip number 3. This is a hot one, and actually a little bit personal. So, Kara, you may or may not know, but you and I are kind of pregnancy twins at this point. I'm in my 3rd trimester as well of my 4th pregnancy, and soon to be my 4th child. And my most recent pregnancy was about 2 years ago, and I had the Tdap vaccine as is routinely scheduled, so no problem there. I'm pregnant again within 2 years, and I was surprised to learn that it's recommended that I get another Tdap vaccine, so that pregnant women should have one in each and every pregnancy, no matter how close together or far apart those pregnancies are.
Yes, this is Kate, and I actually just recently had to get Tdap with my recent pregnancy. As you mentioned, my son is 5 months old, and I know Kara here probably has to get hers.
Yeah, I haven't had mine yet, but I'm sure it's on the horizon.
Yes, and so you do need it for every pregnancy, like you mentioned, to protect your baby from pertussis, or also known as whooping cough. And newborns are the most at risk for severe and life-threatening complications from pertussis. And so getting vaccinated during pregnancy can actually provide your baby with protection when they're born, before they can get vaccinated themselves, and when they're most at risk. So when I got vaccinated when I was pregnant with my son, I passed on antibodies to him that are still providing him with defense against whooping cough now, 5 months later, before he's able to be fully vaccinated himself.
Yeah, and it's the same with influenza. So we know that flu can be more severe for women during pregnancy. I made sure to get my flu vaccination as soon as I could this year, especially when I realized I was going to be pregnant in the winter months. And I made my husband go get his flu vaccine, as well as my daughter, because I didn't even want flu around.
Yep, same for me. So I got vaccinated with influenza when I was pregnant with my son, and this protected, me during pregnancy. But again, he's still benefiting from that as well. And so, providing him with some level of protection against these infectious diseases is reassuring for me as we're heading into, or probably in the full swing of cold and flu season. And I think, all of us, our little ones, have older siblings who probably love to give them lots of kisses and snuggles. And as we all know, toddlers are very good at sharing germs, if not toys.
I can definitely vouch for that. So our 2-year-old just recently started going to daycare outside of the home. And of course, he comes back with every sniffle and cough and sneeze imaginable. So my family members that live in the household absolutely got their flu vaccines. They weren't, super thrilled about it, but we did all go and get our vaccine at the same time. Speaking of household members, how often do household members need to get the Tdap? I know that the flu vaccine should be each year for everybody, but what about Tdap?
Yeah, so Tdap is a vaccine that provides against protection against tetanus, diphtheria, and pertussis. And so it's that combination vaccine. And so many people probably think about getting their tetanus booster, but I think less people think about the booster for pertussis. And so the recommendations for CDC are actually that all persons aged 11 years or older who are going to have close contact with an infant, and so this might be parents, siblings, grandparents, childcare providers, receive a dose specifically of this Tdap vaccine. And so the regular tetanus boosters typically only contain protection against tetanus, or they're the TD vaccines, but the Tdap vaccine, again, has that P on the end saying that it's going to give you protection against pertussis as well. And so when my daughter was born, for example, she was our first child, and my husband got an updated Tdap vaccine, including the P, to make sure, and we made sure that, you know, grandparents and other close caregivers also got up to date with those vaccines. But now the second time around when we had our son, my husband had that recent Tdap vaccine, so he didn't need to get the booster again, even though I, who was pregnant, needed to get that vaccine with Tdap again. And so the difference there is that when I get the vaccine when I'm pregnant, I'm directly passing those antibodies on to my son. So even though I was still protected from my Tdap vaccine with my daughter, I got it the second time in order to protect my son. All household members who have not previously received a Tdap vaccine should be vaccinated ideally at least 2 weeks prior to meeting the new baby. Women who are pregnant, it's recommended to get the Tdap vaccine between 27 and 36 weeks gestation.
So that's really good information about the Tdap vaccine. And also, MotherToBaby is actually doing a study about women who get the Tdap vaccine during pregnancy. We also have a fact sheet on it as well. So for more information, you can definitely contact MotherToBaby if you have questions or are interested in participating in one of our studies. And so that's going to be all for today. So we did cover the first 3 tips with Kate and Kara. And so next time we're going to be covering tips number 4 and 5. So we hope that you will join us. In the meantime, I would like to thank everybody for listening to our podcast. You can find us on iTunes, on Spotify, or however you listen to podcasts. And don't forget to subscribe so that way you never miss a new episode. And if you want to be on the podcast, you can reach us by emailing us at contactus@mothertobaby.org. Or if you have questions about exposures during pregnancy or breastfeeding, or if you're trying to get pregnant or adopt a child, you can reach us. So you can give us a call toll free at 866-626-6847. You can reach us by text at 855-999-3525. And of course, all of our information and more is available on our website at MotherToBaby.org. Kate and Kara, do you want to leave us with anything final, a place where our listeners can get more information about this topic?
Sure, thanks, Chris. If you're looking for more information about birth defects prevention, CDC has a website. It's www.cdc.gov/birthdefects. It has all these tips are listed there, and a bunch of different information about birth defects in general, different types of birth defects if you're looking for more information about specific kinds, things like that. So there's a lot of valuable information at www.cdc.gov/birthdefects.
Great. Thank you so much to the two of you for being on our show this week. And we are very excited to have you back again for those last 2 tips. This is Chris Stallman. Thank you again for joining us. We hope to have you next time. And remember, MotherToBaby is here for you. Take care.
MotherToBaby is a service of the nonprofit organization of Teratology Information Specialists and supported by the Health Resources and Services Administration of the U.S. Department of Health and Human Services. It's made possible through generous donations from listeners like you. To learn more about MotherToBaby, please visit MotherToBaby.org.